Well, first thing is don't panic and don't make a big fuss about it, because it's not considered abnormal until the child is at least 7 years old, because it can take up to 7 years for boys particularly. They take longer than girls. So don't panic, don't make an issue about it. Just sort of ask the child if they've got any issues at school, if there's been any bullying. There could have been a change of school or a house move, or parents may have separated. There could have been some emotional trauma which is upsetting the child and can lead on to bedwetting again when they've been dry. Also just check whether they're actually well. They could have a urine infection. Have they got a fever? Do they not feel very well? Are they complaining of tummy ache or lower back ache? Or have a look at the urine. Does it look normal? Is it very concentrated? Does it smell oddly? If you can't find a reason yourself, like they suddenly discovered Coca-Cola and they're starting to drink Coca-Cola in the evening, if you can't find the reason, then take them along to the doctor. The doctor will just check for an infection, check that everything's normal, that there's nothing else going wrong with the child, they've not got any other kind of illness bubbling away there, and then you can get some help with that. So a lot of schools have got public health nurses attached to them, so you can talk to the school nurse or the public health nurse, because the child might know them and be quite comfortable with that, or you can contact one of the Continence nursing services. Now at Continence New Zealand we have a list on our website with all the Continence nurses throughout New Zealand. Not all Continence nurses see adults, some do adults and children, some just adults. So you need to get a referral from your GP to your nearest Continence nurse, or if they haven't got a Continence nurse, sometimes you go to the hospital to see a nurse at the hospital, or even to paediatrics in some remoter areas. But every area has got a Continence nurse who you can get some help and advice from. So that's the first thing you do. Obviously, if the doctor picks up there's a serious problem, he might refer you to the hospital. But if you look on our website, we've got lots of help and information. We have a good range of leaflets that we produce for adults and children. There's information for teachers, and this one's toilet training for children with autism. Have a look on our website. You can scroll down under information for children. And another thing, we've got two really good publications called A Wee Secret and Pooh Hoo, and this is great because it's designed for children. It's got beautiful illustrations in it, and it helps you open up the conversation with the child about what's happening for them in a non-threatening way, and it make a little story, and it's just a story about how you can recover from this, and it's a really good way to help a child of that age.